This video will be going over aplastic anemia by doing 5 questions. There will also be questions about a bone marrow biopsy and bone marrow transplant, also called a stem cell transplant. And the reason we're talking about that is because aplastic anemia has everything to do about whether the bone marrow is making those red blood cells or not. So if you want any further information about this special type of anemia, you can find the information usually in vascular or the hematological chapters of your nursing resources. So when the question pops up, I'll read it to you, especially for those that are listening to this video, then give you a chance to think, then the 4 options will pop up, and then we'll talk about which one is best. So let's get started. Question number 1. A 50-year-old female patient comes to the clinic complaining of dizziness, weakness, fatigue. The nurse notices bruises on the patient's arms. What is important for the nurse to ask when considering the risk factors for aplastic anemia? Is the answer number 1, dietary preferences, number 2, occupation, number 3, activity level, or number 4, alcohol use? So the answer here is number 2. In the question, she has some general signs of anemia, dizziness, weakness, fatigue, and then she has the bruises on the arms, which is specific to aplastic. And it's asking us what are the risk factors for the aplastic anemia. So the thoughts were about anything that causes bone marrow suppression, because anything that damages the bone marrow, causes it not to work as well, and stops those red blood cells from forming within the bone marrow, that is what aplastic anemia is. And so in the choices, the only option we had that made any sense was what is her occupation. So in the further learning, bone marrow suppression can be caused by chemotherapy, radiation, bone marrow suppressive medications, chloramphenicol, sulfonamides, anticonvulsants, and some antibiotics, exposure to toxic chemicals, maybe in your occupation, benzenes, insecticides, some autoimmune conditions like lupus, though that affects the bone marrow, some viruses to include hepatitis, Epstein-Barr, which is mono, cytomegalovirus, HIV, and sometimes they just don't know why the bone marrow isn't working, and that would be called idiopathic. So a final question here is with these bruises, why does aplastic anemia cause bruising? And we're actually going to get that answer on our next slide. Question number 2. An oncology nurse receives a client admitted with a diagnosis of osteosarcoma and aplastic anemia. Which signs and symptoms could the nurse find on the admission assessment? Select all that apply. Could you find hematuria, shortness of breath, bruises on the arms, and or fever? And the answers are all of the above, 1, 2, 3, and 4. So in the question, we are trying to find signs and symptoms that we would see on admission, and this honestly could be for aplastic anemia or osteosarcoma. And what we need to remember is that the signs and symptoms related to anemia, which could be any general signs and symptoms, as well as other issues related to bone marrow suppression, which would include suppression of any of the 3 cells that are made in the bone marrow, red blood cells, white blood cells, or platelets. And so if we true-false this, number 1 was true, that would be a sign of low platelets. Number 2 is true, that's a sign of anemia. Number 3 is true, again, sign of low platelets. And then number 4 is true, that's a sign of possibly a low white blood cell count, is that they have a fever. So the answers were all of the above, and in the further learning, it's important to remember that aplastic anemia is a special anemia that presents with bone marrow suppression, causing signs and symptoms for all 3 of the cells that are made in the bone marrow, red blood cells, white blood cells, and platelets. So when bone marrow is damaged or not working, the result in the lab is pancytopenia, and pancytopenia means all 3 of those are down. So labs will show anemia, which is low red blood cell count, hematocrit, and hemoglobin. All those will be low. And I have a quick little reference tool there for you. Instead of remembering the range, if you can just remember the number 4, that's very helpful to quickly spot what might be looking like an anemia. Red blood cells are less than 4.0, hematocrit less than 40, hemoglobin less than 14. Just remember the number 4. the lab would also show leukopenia, which is low white blood cells, again, less than 4. You can use the number 4 for that one too, 4,000. And then also that the platelets aren't being formed in the bone marrow either, so low platelets, and that's less than 150,000. So besides just the general signs of anemia, like the shortness of breath, the fatigue, the weakness, maybe even chest pain if it's bad, they're also going to show the signs of a low white blood cell count, which could be maybe infections, sore throat, fevers, and then the signs of low platelets, easy bruising, nosebleeds, blood in the stool, bleeding gums. And so therefore we had that last question that said, why are there bruises on the arms in this type of anemia? And that's because the bone marrow is also not making platelets, making it easier for them to bruise. Question number 3. A client with suspected aplastic anemia is ordered for a bone marrow biopsy to confirm the diagnosis. After the procedure, the patient returns to the unit. What is the most important nursing consideration post the bone marrow biopsy? Is it number 1, to monitor for infection, number 2, monitor for bleeding, number 3, treat pain complaints, number 4, maintain a dry sterile dressing? They all look pretty good, but the most important one is number 2. So in the question, you always want to pay attention to if it's before, during, or after the procedure. So this is after the procedure, so you can see the picture there. They stuck the needle into the bone marrow. And what is most important? When we see that word most important, we need to be thinking about Maslow. Maslow says that physical fatal is most important. So the thoughts post-op would be things like bleeding, infection, and pain. And I see bleeding and infection, and actually I see pain too. And in order of which one's more serious, bleeding is the most serious, which means our answer is number 2. So in the further learning, it is a good idea to know the nursing considerations for any procedure that you're involved in, pre-op and post-op nursing considerations. So for the bone marrow biopsy pre-op, we would want to make sure the consent is signed. We're not obtaining that consent or telling them about it, but we're just checking that the consent is signed and witnessing their signature. Some baseline vitals would be good, and maybe a baseline CBC so we know what they're starting out with as far as their red blood cell, white blood cell, and platelet levels. Post-op, we want to make sure that we keep pressure on that area so it doesn't bleed, especially since they're probably going in with those low platelets. They'll be at risk for bleeding post-procedure. We also have to monitor for infection at that site, especially because they have a weakened immune system, their white blood cells are down, and then it's going to be uncomfortable. So those 3 things are what we are thinking post-op. We should also maintain a dry sterile dressing over it. That is correct. And however, in the choices, we're always thinking about most important, physical, fatal, what could really cause them harm first. And that's why number 2 is our answer. But I actually liked all the answers. Sometimes it isn't about what's the right answer, but it's about which one is best. Number 4. The nurse is preparing discharge teaching for a client with aplastic anemia. What will be important to include in the teaching plan? Select all that apply. Is it number 1, take iron with meals every day and decrease the amount of green leafy vegetables in your diet? Number 2, establish a balance between rest and activity, avoid excessive fatigue. Number 3, rest and supplemental oxygen may be required during periods of dyspnea. Number 4, notify your healthcare provider if you begin to experience frequent bruising. Number 5, filgrastim injections done Q-day will help stimulate the bone marrow. And the answers here are 2, 3, 4, and 5. So in the question, it just wanted us to think of anything we could remember about teaching for aplastic anemia. And so I would be thinking about the physical signs and symptoms that they need to be aware of. They need to know how to manage their anemia, which also, because the bone marrow issue, to manage the leukopenia and thrombocytopenia, and to take their medications as ordered. So if we true-false this, because it's select all, true-false is one of the best methods, Number 1 is false for 2 reasons. 1, you should take iron on an empty stomach if tolerated. And 2, we wouldn't want to decrease green leafies. Green leafy has iron in it, also has folate, and those are 2 building blocks of red blood cells. So even though it's not the problem right now, it's not a folate or iron problem, it's always great to just get them to take anything that would help their red blood cells. So number 1 is false. Number 2 is true. That's for anybody with anemia. It's a good idea to have rest periods. Number 3 is true. Again, that could be anybody with anemia. Maybe they would require some oxygen. Number 4 is true. This is specific for aplastic. If they get frequent bruising, they need to check their platelets. They might be dropping even more. And then number 5 is true. That is a medication that can be used to stimulate the bone marrow for aplastic anemia. You might have also heard about it in leukopenia or leukemia to help also build up white blood cells. So 2, 3, 4, and 5 were the answers. And in the further learning, just some other considerations here. Clients with this type of anemia can also be treated with hematopoietic agents. That's just a fancy way of saying other supplements that build up the red blood cells, like iron, B vitamins, even if it's not the actual etiology. And then the medications, bone marrow stimulants, there's a bunch of them there. Sargramostim, filgrastim, they all kind of end in stim, except for the last 2, epitin alpha. You might have seen that one as a building block for red blood cells in renal. Can be used here. And then you've got one more there. I'm not even going to try to pronounce that one. Any of those can help build bone marrow to make new blood. Question number 5. The nurse is caring for a 14-year-old female diagnosed with aplastic anemia. The patient undergoes a stem cell transplant, which is the same thing as a bone marrow transplant. In considering the immediate post-operative plan, the nurse will prioritize which action? Is it number 1, allow parents to bring their daughter flowers? Number 2, allow peers to visit? Number 3, maintain reverse isolation? Or number 4, teach about the risk for graft versus host disease and the need to be compliant with immunosuppressive therapy? And the answer here is number 3. In the question, we needed to pay more attention to that she's immediately post-op and what is her plan? What will we prioritize? And the thought is to prioritize by Maslow, and Maslow says physical fatal issues are first. So anything she'd be in danger of right away would be bleeding, infection, anemia signs and symptoms, and rejection. That is graft versus host disease. Rejection can happen within the first few days acutely, and it's very dangerous. But in the answers here, we're going to go with number 3 because we don't have a bleeding option. And number 4, it says teach about it. It doesn't say to monitor for it or assess it. So teaching is less of a concern as assessing for it. So in the further learning, the answer was number 3, and that is because the patient is at very high risk for infection until engraftment of the new bone marrow happens. Engraftment would mean that the new bone marrow is starting to work and create new white blood cells. So for the moment, basically consider that she has no immune system. The common cold could make her incredibly sick. So we need to protect her, and that is why we picked number 3, reverse isolation. Reverse isolation means we don't want any pathogens coming into the room. Normal isolation says we don't want pathogens going out of the room and infecting other patients. But because this patient is at risk, she's neutropenic, she has no white blood cells, we are going to protect her. So we're not going to let anybody come in that is sick, and any people that aren't sick that want to come visit her must wear a gown, glove, and a mask. And we definitely don't want people bringing in fresh flowers and fruits because those can contain pathogens. So we're protecting her immune system right now. She might also have issues because she's not creating new red blood cells right away. So the signs and symptoms of anemia, she'll be very fatigued and short of breath. She might need blood transfusions. And we should be monitoring for that graft versus host disease, which is rejection of the transplant. And it usually starts with GI issues, but it's just an immune response. She could have issues in her joints or muscles, shortness of breath, cough, vision changes, dry eyes, skin changes, a rash. The liver can get involved, yellowing of the skin, and the whites of the eyes, dry mouth, mouth sores. There's a lot of symptoms for that graft versus host rejection. That's it. Hope that helped you review aplastic anemia. Please subscribe to our channel if you like these videos, and don't forget to hit that like button. And you can always find us at signstrategies.com.